Hello, everybody. So I am at last interviewing Elrina Van Zyl, who is a very great friend now, and she's a fantastic pelvic floor physiotherapist, amongst many other things. So, Elrina, welcome, and thank you so much for joining me tonight. So the main thing really is to ask you to explain what a pelvic floor physiotherapist actually does. And so that we can move on to how you might be able to help women who have got various pelvic floor issues. So if you could explain a bit about you and kind of what you do.
Okay, well, if I introduce myself, I started life as a physiotherapist about 26 years ago now, almost 27 years ago now. And it was sort of quite an organic way for me to get to women's health, because I started just musculoskeletal, and then from there into acupuncture, women's health acupuncture, and then sort of exploring more the physio side of women's health, physiotherapy. And that's been a bit of an evolution of my career so far. And amongst all of that, I picked up some other bits of knowledge about healthy lifestyle, nutrition, because I'm going through menopause myself. That's an area of interest. I've been studying that as well. I did my mummy MOT training with the first group of women that trained about 6 years ago now, and that's quite a big part of my practice now, looking after postnatal mums, but then also looking at women later on in life. So when they, struggling with problems that often started postnatally. So I think it's important for us to almost get women educated so we see them before they even go and have children, so they can prevent the issues that happen during pregnancy, after pregnancy, and then are with them for life, and certainly show their faces when they go through menopause, when a lot of issues start getting worse, because we think things are going to get better and they don't necessarily.
That's the shock, isn't it? That's the shock when that estrogen starts to drop and suddenly, you're hitting sort of 45-ish, and then all those, muscle fibers start to become less elastic, and suddenly the issues that happened during those births come back again.
Yeah, they come back and bite you. So, and I think what happens in those early years when you've had a baby is you're so focused on your child, and such a very busy time, and you're so outwardly focused that I think women very often don't take care of themselves very well. And certainly, I don't think the system here is set up very well to take care of women postnatally. So that's really unfortunate, and hopefully that will change in the years to come.
And in France, they've got the fantastic, don't they? They have the...
So Maria Elliott, who was the founder of the Mummy MOT, worked in France for 17 years and came back over here and was just astounded at the lack of postnatal care. So that's why she's training physiotherapists from all different walks of physiotherapy to come into women's health. And Diane Lee is one of the real pioneers in women's health, talks about women's health physiotherapy basically being musculoskeletal therapy in a cave. And I love that, because just skeletal muscles, there's not any big mystery as to how they work and all that. They can tear, they can sprain, they can get trigger points, they can be tight, they can be short, they can be long, they can be weak, just the same as any other muscle in your body. The problem is that when you have those issues in your pelvic floor, you have organs that need to be supported by those muscles. And oftentimes that's when the issues start, any weakness in the pelvic floor, any tightness, which stops you from having a decent contraction, any pain, again, stops you from having a decent pelvic floor contraction, and maybe just on one side or the other side. I'll show you guys the model in a moment. Can cause issues. And I very often have women coming in with hip pain, knee pain, back pain, and we trace it back to the pelvic floor musculature that isn't working as well as it ought to. And when I trace that back even further, more often than not starts postnatally. And then if we look at the biomechanics, it could go back even further to prenatal and even injuries that have happened during childhood. So essentially what a women's health physio does is musculoskeletal therapy in a cave. So
love it.
And when hopefully some man has gone before, but otherwise there wouldn't be any babies. But it is about finding out what is wrong with that pelvic floor. Is it short and tight? That doesn't make it strong. It's the same as if I had a muscle that was sitting up here. I wouldn't be able to pick up my cup of tea. If I did want to, I'd have to use my whole body to do that. And those compensations happen all through the body then. Or is it really lax and loose? Is the woman hypermobile? Has she had, other kind of musculature issues? Is there hormonal issues going on that's causing everything to sag and relax a little bit more than it needs to? Natally breastfeeding, obviously you're full of relaxed air, everything is really super relaxed, the ligaments give way, and there's just so much more space and risk of injury in that time, because you've got those hormonal things going on, as well as then in menopause, as you mentioned, with your estrogen levels dropping, then that causes that issue as well. So we go in, we assess, look at it. Is it weak? Is it tight? Is it short? Is it painful? Is it dry? What's the skin look like? What does the skin feel like internally? Are there any prolapses? Is the bladder sitting slightly low? Is the urethra sitting low? Is the uterus sitting low? What's happening with the rectum? Is that pouched forward? How can you support those organs? Sometimes, there's a need for maybe a pessary to give some support. Sometimes pelvic floor exercises, more often than not, will do the trick. But knowing you're doing them right, knowing you're contracting in the right way, and knowing you're not just holding. If the pelvic floor is really short and tight and you're holding it all the way up there, there's no way you can get a contraction from there. And often this is what I see in people who are very physically active, that run a lot maybe, or do a lot of hip sessions. Their pelvic floors are weak, but they're short and tight.
Yes.
Hypotonic is the word we use in women's health.
And they start to leak. And I just wanted to jump back, if you wouldn't mind just speaking about pessaries for a moment, and if you could come a little bit closer, because I'm hearing you drop out. But I know that for a lot of women, pessaries could be a fantastic solution to get them back to doing a little bit of higher impact exercise. So could you just explain what a pessary is and how it can help?
I don't actually have any in clinic because I don't fit them myself. It's just quite a complex thing. But I think what you need is to find the right pessary for you. So you could have a ring pessary or a shelf pessary. There are loads of different ones. And what they are is an object that goes into the vagina and then supports the organ. So it creates, if it's a ring pessary, for instance, will sit just inside the vagina and hold the organs up. So for instance, if you're having heaviness or dragging or leaking when you run or jump and you want to be doing your CrossFit or whatever it is you're doing, you could do that with a pessary in, if you're trying to avoid maybe a surgery.
It's kind of like a
brace for your pelvic floor,
isn't it? Like if you've got collapsed arches, you might use an orthotic in your shoe. Doesn't mean you don't want to strengthen the arches of your feet still. That's very important. But in the meantime, it could be something that just helps you to get that arch support.
It's very similar to an orthotic, or like wearing a back brace or something. It's just about bracing and holding the organs, so that if you have a certain type of prolapse, it's not going to necessarily get worse because you're continuing to do things that you love to do and they give you quality of life. So there are specialist practices that fit them. Mostly, I think I'd refer back to the NHS for that, because they have the scope. They have loads of different types of pessaries, loads of different sizes, because you can try one, you walk out and it drops out, and you've got to try a different size up. So it can be quite a process to get one fitted, but once you've got one, it can be a real life changer for a lot of women.
Yeah, brilliant. No, I thought that was good just to touch on. And interestingly, I remember us talking about how, yes, you might be very hypotonic or hypertonic, but you can have very much a mixture of both, can't you? You can have
you can find one side of the pelvic floor short and tight, and the other side is just not even contracting, loose or torn, or So if I show you a pelvic floor model, the thing is with most of us, you don't find out about your pelvic floor until after you've had children, and then people assume and tell you to do your pelvic floor exercises, and you've never been taught how to do them, and suddenly you feel like you're stupid to ask because everybody seems to know, but in fact nobody knows. Let me tell you, nobody knows, okay? So it's a good idea to actually go and see a physio that can have a look for you and feel into it and tell you what you're looking for, or using a device like the Pelviva that I've suggested to you as well, that you insert internally. I'll show you how those work as well.
Brilliant.
And just give it a muscle stimulation so that you can get familiar with what it should feel like. And then get into a routine of doing them every, 3 times a day in different positions. Pointless doing pelvic floor exercises lying on your back if you're leaking when you're running. You need to be doing them standing. You can start lying on your back until you get the knack for them, try them sitting, try them standing, and try and do them on one leg. That's when you need it, So it's important to be able to get your pelvic floor to contract through different positions as well. But sometimes if somebody's got a pelvic floor that's particularly short and tight on one side, I'll actually have them position their leg in a different way so that we can, if they're very hyperactive through their adductors, for instance, to pull up the pelvic floor there, we'll stretch the adductor out and then try and isolate the pelvic floor from that side. So I don't want to get too complex, but it gives you an idea of there's different ways of doing things for each individual patient.
And I love when you explained to me once how, if you had a big knotted neck, and you just need to get in there and just release that knot before you're able to get that nice dropping shoulder, and therefore able to do some shoulder exercises. It's the same thing, isn't it?
It's exactly the same
make
thing.
it very normal. So I think for a lot of women, the thought of going to see another woman and having somebody, not a doctor, where it's just a kind of like, oh my goodness, well, are they going to have judgment over what it looks like down there, etc. So maybe you could just speak to the ladies a bit about how you make them feel comfortable. And
well, I think, so far my patients seem to be pretty comfortable around me. I think I'm very comfortable doing internal work, whether it's vaginal or rectal. I'm very comfortable talking about these things, and I think because I'm comfortable, it means the patient feels more comfortable. They don't feel judged. Certainly there's no judgment coming from me. I try and have a very open mind and open heart and a comfortable situation. And I've had patients who are very, very nervous coming in, and one of the ladies you sent to me, who said that, she got so relaxed while we were doing it, she felt completely different by the time she left. So that's a big thing for me, to set people at ease, because it is just a regular another part of your body.
This is the thing, if we had a torn ligaments in our ankle, say we rolled the ankle and it was really all swelled up and it was really sore, we would know that we would need months of slowly rehabilitating that ankle, slowly, seeing a physio, getting it strapped, maybe, icing it, looking after it, very slowly building up to being able to walk properly, and then slowly running. But it's crazy how in our society we expect, well, we think
6 weeks, suddenly this magical 6 weeks, and you out of the woods, you've done nothing to rehabilitate, but suddenly you can go running. Yeah, that does my head in. So yeah, I think if you think of the trauma of childbirth, and I'm not talking about a traumatic birth, I'm talking about a regular birth, any normal birth, that is really traumatic for your pelvic floor. It's like running a marathon. Even if you had the best, most wonderful 3-hour labor and baby just fell out, wonderful, you still are going to have some trauma to those muscles. So you're still going to need some rehabilitation. And it might be that your body does that all by itself and it's all good and fine. But for a large portion of women, they do need some help and support. And I think one of the things is we need to do as pelvic floor physios and for yourself as well as practitioners in this area is to demystify this topic for women. It's not a mystery. It's a muscle, as you say. It's a ligament. It's just inside. It's like your tongue. If you've got a toothache, you go to the dentist. He's right there in your mouth. You don't feel embarrassed or ashamed or any kind of emotion about it. You just need to go to the dentist. And for me, it's the same with the pelvic floor. And I think one of the issues that have happened for us over eons, I'm sure, in patriarchal societies, and I don't want to get political or feminist about this, but the word pudenda, the pudendal area down bottom, the word pudenda actually comes from the word shame. Don't know if you knew that.
I didn't know that. How crazy.
How crazy is that? So it's this shameful area, and for so many people it has remained that, even though we, sexually enlightened, earning our own way through life women, and yet here we have this, like it's like not opening your mouth when you go to the dentist, So, yeah.
Gosh. And so many people, women I've come across over the years, literally have no relationship with anything from their belly buttons down, and don't and I think over time we can lose that identification with this, this
lose the connection,
central part of who we are, and it is potentially quite an English thing to just not talk about things that are going on down there, and a bit of a laugh, a bit of a joke about leaking, and actually, because I always find myself saying, do you know what, it's not okay, and there's so much we can be doing about it. And I know we're having a laugh right now, but it's actually it's not okay just to laugh about it and carry on.
I'll tell you why I think it isn't funny is because I see how this affects marriages. If you're leaking and you smell of urine all the time, you don't feel sexy. If you don't feel sexy, you don't reach for your husband's hand on the sofa. If you don't reach for your husband's hand on the sofa, you don't have a cuddle. You see where that goes? And then this comes back to the pudenda, the shame. And that is such a shame because there is so much that can be done about it. we don't fight gravity. I mean, we do. We know you put all our lifting creams and headstands and yoga, whatever. But for the most part, we just accept gravity, don't we? Because there's nothing you can do about it, and that's fine. But this is not gravity. This is something we can do something about, and absolutely can be empowered about. Even if there's degrees of healing, depending on the level of injury you've sustained, there's still something that can be done. Whether it's a pessary, whether it's surgery, just keeping an open mind about the fact that, I've just torn something in my shoulder and it's probably going to need surgery, but I've done 18 months of rehab on it, and I've come to the conclusion that I'm probably going to need surgery,
Okay.
But I think for us, if we have the same attitude to the pelvic floor, like, let me see what I can do, and at the very end of the spectrum, if nothing can be done from this perspective, conservative care, then we can look at surgery. And I think that's the way to think about it. And, whether it's the organs or the muscles or the ligaments or whatever it is. But something else I wanted to touch on is, I know we have this, incontinence issue, or if there's a skin condition down there that just gets ignored for the most part, which I could, my blood pressure. And I think to myself, if we just had to have the openness that we have about any other body part in this area, how much tragedy would we be avoiding for women, in their relationships and their intimacy and how they feel about themselves, and it's not okay. You're not responsible for what happens down there. Well, you are responsible, but it's not your fault. It's not your fault when something.
So much of that is knowledge is power, isn't it?
Absolutely.
Because what you don't know, you can't do anything about. But if you do know leaking isn't normal, don't go and run if you're leaking. Rehab first, build up your glute strength, make sure you've got good pelvic floor activation, slow, do your exercises and things, and then start building up towards running. And I think just get that message out there, and I try and get the message out of preparing for birth, so that people know how to birth in a way that is going to minimize trauma, if possible, minimize forceps delivery, or if they do need a forceps delivery, positioning to get into, how to use the voice and relaxation of the pelvic floor muscles in order to aid that baby's passage down. And then also afterwards, knowing that it's, those first hours and days to start getting the breath and the pelvic floor slowly reconnected, and that it's not, I didn't know this stuff when I had my first baby.
I certainly did it. I was about 12.
Not quite 12, but
not quite.
Not quite 12. But we don't. But what we know then, when we do know this stuff, we can tell other people, and we can start to spread as a grassroots revolution.
But again, coming back to shame, we need to talk about this without shame. It's not my fault this has happened, but I'm taking responsibility for it. I'm taking responsibility for my healing. When you sprain your ankle, it's not your fault if you stepped on something skewy. You just sprained your ankle. But what you're going to do next is you're going to take care of it. You're going to ice it, you're going to splint it, you're going to rest, you're going to rehab, you're going to do what you need to do. See the physio if it doesn't heal. And it's exactly the same for the pelvic floor. So I think with that whole demystifying it, taking the shame away, and just understanding that actually this is something you're in control of. And you said it's not normal, but it is common, So that's one of the big things we say in physio, it's common but not normal to be. Now, one of the ladies I was on course with had a real reaction to that. She said the last thing she wanted to hear was that she wasn't normal. When she was
interesting.
I can sort of get that, but again, I think we have normalized something that is pathology. There is something wrong when you are leaking. Even if everybody's leaking, there is something wrong, and we can fix that, or you can fix that, and we can show you how. So, shall I just have a quick show of the pelvic?
Yes, please. Yes, great.
So this is just a very basic model of your pelvic floor. So as you can see, there's muscle. And
we can't hear you, Elrina, so I think you might be covering the... Yes, that's better.
So what you can see here is that there's muscle and bone, just like anywhere else in your body. No mystery. Muscles that hold up the pelvic floor, muscles that connect through to the hip, muscles that connect through to the sacrum and the coccyx. So very often when women come in with coccyx pain or sacral pain, we'll work internally and release these muscles here, because actually I can't get to them from the back. I can get to some of these guys, well, you can't really get in, but you can see they sit behind the bone. I need to get in there, and that's what I do. So no mystery. These muscles will connect into the hip, where the rotators of the hip sit, and they can be really, really sore and tight. And you can have like these muscles can be really short and tight, and those can be really long and floppy. So some injuries will be in the avulsion here, where there's actually during birth pulls away from bone. And then there's a lot of rehab that needs to be done to strengthen the muscle surrounding it, because it doesn't actually grow back, that one. It's called the levator ani avulsion, and you can have several degrees of it, either the whole muscle or partial, depending on. I've had ladies who've had a tear right through this muscle here, all the way through, and we've had really great results with rehabilitation. But again, if they didn't do it, I don't know where they would be, you know. I've certainly seen a huge difference just doing the scar tissue work, and with patients who are very diligent about doing their own scar tissue work, the difference between a patient who's diligent and one who isn't, and how they rehabilitate and how they do that. So that's the basics sort of pelvic floor. I won't go into the details of muscles.
So actually on that, when you touched on scar tissue, because a lot of people have asked about episiotomy, who, you know, still do have uncomfortable scar issues, and I've talked about a little bit about, you know, release work. Could you just speak a bit about the what you can do to help those adhesions and the tension patterns that are scar?
Yeah, so I mean, we can work on the outside musculature, you know, all the way in there. Sometimes I get in there. I use tools, and I give patients tools to use. I know this looks scary, but I use this internally sometimes, and I've had really great results using this internally, obviously within a glove and working with that. But that actually really releases the fascial tissue that gets stuck in the layers, you know, the sort of tissue that sits around the muscle that isn't necessarily the muscle, but gets stuck with those layers of scarring. The other tool I use, I actually don't think I have it in here, something called an Easy Magic. And the Easy Magic is like a glass. Let me just see if I've got mine in here. I'm pretty sure it's next door. It's a glass tool, and it has, you know, a particular shape that helps you release your own trigger points. And I'll use that. If you've got one, I'll use that to show you how to do it. Where, you know, in between sessions, if you've got a trigger point, it's no different. Again, the tennis ball in a sock for in between the shoulder blades, or a roller for your thighs or your glutes. Same thing, different tool, same premise, you know. So what I was going to say is, so well, with the pelvic floor, now you've got organs that need to fit in there. You know, you've got a uterus and a vagina that needs to go in there, and you've got the rectum. Sorry, I'm on the wrong camera. Rectum needs to fit in there, and a bladder that needs to fit in there. So that's a pretty cramped space by the time you put everything in there, you know. So not arranged in such a way. Understanding why when you have erector seals, for instance, it's really complicated, why you leak sometimes and not other times. You know, you can understand if you have a really full rectum and you go for a run, suddenly you're leaking, and other days you go for a run and you don't leak. Or you go from, a patient of mine was saying today, sometimes when I go from sit to stand, I'm leaking, and other times I can hold on for ages and I don't leak. And I haven't actually assessed her physically, it was a virtual appointment, but I can tell you now, when I assess her, she's going to have a rectus seal, I'm pretty sure, and that's going to be when her bowel is full. You know, her rectum is full. So it's about understanding the anatomy of what's going on in there. You know, it's not necessarily that the bladder is that weak, it's just that there's so much pressure on it, you know, that it just can't cope with that extra load. And
that's also, so I was just going to say, when you're coming towards your period, if the uterus is that little bit bigger, exactly, and heavier, and if your detrusor muscles around the bladder are a little bit more agitated because you're drinking a bit too much coffee and tea, and especially around that perimenopausal time when the lack of estrogen is making everything a bit more sensitive, then that extra little bit of pressure can cause leaking, whereas, you know, after your period there might not be any leaking.
Exactly.
It might be
it just tips you over the edge. And you can also find some patients, when they've got endometriosis and there are loads of adhesions through these tissues, they'll find, you know, going to the loo just before the period is really, really painful, because there's everything just has loads more blood in it. You know, the whole area when you're ovulating and just before your period, is almost every artery, every vein is like 10% bigger. So you can imagine the pressure down there. You know, if you imagine your whole hand, every vein, every artery, everything is 10% bigger. Your hand would be twice the size. So you get that idea of what's going on in the pelvic floor in terms of congestion, just, you know, at certain points of the month. So it's about
fascia, isn't it?
Yeah,
about the fascia around the whole pelvic
so we've got fascia everywhere. I mean, it starts, you know, at the bottom of your foot and ends at the top of your scalp, and knits through. And if you look at some of, I'm going to forget his name now. Great cook. The fascial guy, fascial trains. Sorry, Linda, I've gone blank.
Don't worry, I can't remember. Doesn't matter. Yeah.
menopause joy for you. But you can see, you can track where the sort of connective tissue goes around the muscles, through the tendons, up and crosses over through the sacrum and up to the end of the scalp. So an ankle issue on the right hand side can give you headaches on the left hand side, And we must remember that crosses over through the pelvis as well, and through the pelvic bowl. There's all this fascia holding things together. And one of the most important relationships, fascial relationships, that I find is the one with the diaphragm, the breathing, and the pelvic diaphragm. And you'll know this better than most people, is that relationship of where most people, when they lift and push and pull and carry, holding their breath, pushing down, increasing that intra-abdominal pressure, increasing the pressure through the pelvic floor. No wonder it blows out, So about learning how to work with your breath when you contract the pelvic floor, because if you're doing it correctly in a way that is anatomy, or what we call biotensegrity length, you'll find that as the diaphragm comes down, the pelvic diaphragm goes down naturally. And as it lifts and you breathe out, the pelvic diaphragm comes up. So this is why we want to encourage an out breath on a contraction. So that's the big thing, as you know, we both talk about this quite a lot, about not holding the breath, about not breathing in and holding, pushing the diaphragm down and then pulling the pelvic floor up. No wonder you blow out through a diastasis and end up with a diastasis at one heel. So there's all these things to think about. So fascially, we have releasing a lot of what I just, sorry to interrupt, is a release through the ribs. And again, I think I blame bras for this, and I've been loving lockdown because I've hardly worn one at all, and I just feel wonderful. Just about not wearing it, because you've got this very tight band sitting right where your lymph needs to be draining up into your axillaries, and getting rid of your toxicity. And I feel through those ribs, and they are full of like lumps of tissue sitting, not tissue, but like exudate sitting stuck between the layers of fascia where they just can't move and there's just no circulation. You see that on the inner thighs, and sometimes you can see that right into the vagina where there's been trauma and the tissue, the two fascial layers have maybe gotten stuck. You now have, these little bubbles, they feel like bubble wrap almost, and they can be pretty painful to release. Once you release it, you get that lovely glide and slide. So organs can glide and slide. And even viscerally, if you're looking at the abdomen and some visceral work that we do, a lot of what we do is just repositioning the organs again and helping the body to sort of settle back into where it was pre-pregnancy. The organs have been pushed right up into the diaphragm. I mean, if you look at those MRI scans, you see, the poor liver is like right under your armpit almost. And then just helping and encouraging them to come back down to where they belong and getting rid of those adhesions. And that's very, very helpful by having a decent breath and a good pelvic floor release. But manual release is quite a key thing there as well. And I train my patients to do a lot of it themselves, in the shower, combing through the ribs and getting the organs to move just gently. It's a very gentle technique, but the body does need to readjust to where it was before.
Oh, that's so wonderful. That's, as you know, I'm so big on breath work. Because of getting that full diaphragmatic breath and working into those intercostal muscles and getting that relationship with the pelvic floor working. But it's so wonderful for me to be able to, if the basic stuff that I teach isn't enough, and for most women it's not actually. I needed to come. Just an aside, everybody. I knew Elrina professionally, had sought her out so that we could start building relationships, so I could send students who really did need extra help to see a professional like herself, but ended up going to see her myself. And so that's kind of weird, but actually completely not weird, because she is such a
I don't find it weird at all.
No, I mean, before I saw you, I was thinking, oh crikey, how's this going to be? Because you've become a friend of mine. But actually, I found that my own pelvic floor journey and having the 3 births that I had and various traumas happening, and then going to perimenopause, you can have a toned pelvic floor, but if the muscle fibers deeper into the bowl are becoming weaker because of hormonal issues,
estrogen. Yeah,
you need to be doing other things, working deeper into the pelvic bowl to get those stabilizing muscles working more. Or in my case, I needed some release work, didn't I? Before I could get a deeper, fuller contraction, and then I don't know about you. I my personal journey, I have found that using supplementing with a bit of estriol, a little bit of the estrogen cream,
it can be
not very often,
life-changing.
even now and again, has just helped plump everything up, if you like. And I know that lot of people have found that's been very helpful.
Yeah,
and you've got other, if you've got other things you recommend as well, don't you? Not just the HRT, but other.
Yeah, so I mean, it depends on each journey. It depends on the patient and what they want. So looking at the sort of hormone reset work that I did last year, training in it and doing it myself, I did find that usually helpful. It is quite labor intensive and expensive, so it is easier and cheaper to go into HRT, I must be honest. But I'm glad I did it, and I certainly still err on the side of that kind of diet, high in the protein, keeping the carbs low, because it helps with that whole insulin issue that happens, and it certainly helps to change the way you train from a cortisol point of view as well. So there's lots that can be done naturally if, for instance, you don't want to go on HRT for whatever reason. But there's certainly enough research for us now to look at it and look at the safety track record to say, actually, you know, it's bone protective, it's brain protective, it's protecting the muscles, so, and the fibers, as you say, which then is really helpful to keep you training, keep you fit and active, which keeps the bones really nice and strong. And because the muscles are putting that tension to the bones, keeping the bones strong, and then you don't end up with the fragility fracture later in life.
Lovely circle, don't you? And I think that took me a little while to appreciate, because I was, you know, I think when I was sort of 46, 47, I was 48 when I started, I was thinking, oh no, I want to do everything naturally. And I didn't really appreciate that actually, especially the body identical hormones are natural. That is what our body is producing ourselves. And actually just getting that link back and being able to have the energy to then exercise and to, in my case, teach and do the things that feed into my life and my sense of well-being. Whereas when you're feeling absolutely rotten and when you're leaking and when you're not able to, you know, even do little bits of exercise, it's very easy to go down that slope quickly, isn't it?
And sadly, we see a lot of women on antidepressants when in fact they should be on HRT. And antidepressants don't help for that kind of mood issue. If it's a hormone-driven mood issue, the antidepressants are not going to help for it. So it is a good idea to go see somebody who knows what they're talking about and who can help you properly with that. And to do that from a fairly youngish age, you know, I'd certainly be considering this from mid-40s and even early 40s if you've got any symptoms. And I think something that you've been great at is sharing those symptoms that are not the common ones, you know. I have women coming in, oh no, I haven't had a hard time with menopause because I haven't had any hot flashes or night sweats. I'm like, well, how about word buzz? Oh God, I can't remember anything. And how about, you know, crawly, itchy skin or vaginal dryness and all these other things? And they are suffering really badly, but they don't realize it's all part of menopause because we haven't educated them, and that is our responsibility because we do know, and it's our job to go and tell people about it. So we blow the vuvuzela for them, you know, just make sure that the trumpet is blown and they get the information.
But it's, and people ask me all the time, oh, I'm feeding back. People ask me all the time, why is this information not out there? Why do my doctors not know? Why do I keep going to my doctors and saying I've got, you know, like you say, itchy skin, aching bones, utter exhaustion, you know, mood swings? Why do they not take all of these symptoms and see what's going on and talk to me about perimenopause and talk to me about this new HRT? And it's really hard to recognize that at the moment, GPs, just general practitioners, don't have the specific training in.
Well, the aim is that every GP practice should have one of their GPs trained with the British Menopause Society. So they should have somebody, but a lot of practices don't. As far as I know, certainly my own practice, I've just moved practices because of it, because I had very, very poor experience with it, which is very common for most of my patients, which is sad and unnecessary. And then people miss that golden window of opportunity where you can still have such an effect and improve quality of life long term, as well as, you know, from a bone and muscle and heart protection point of view. And they miss that opportunity because they won't be given the you know, the help, the education. And even as a medical professional, I was told, you're menopause. There was no further conversation. There was no offer of HRT. There was no education. That was 2 years ago. I went back. I had another conversation. No help. Tried to get some help again during lockdown, and I ended up going privately. So it's very disappointing. And I'm sure it's not necessarily true for every practice, but unfortunately, I'm finding that more than I'm finding it not. So.
And actually, at the end of the day, and it's unfortunate. It's a little bit like preparing for birth, and the shock that many new mums find when they are in a birthing situation and they realise for the first time that all the people there are not 100% focused on their well-being. And it's a shock because you realise that, oh my goodness, I am the only person who truly, apart from my partner maybe, truly is worried about me, and not just the baby but me too. And it's the same, I think, with sort of perimenopause and menopause. It's when you realize that it's up to us to do the work. I mean, it's like when you do have children, you realize that as their parent, it's almost like a project manager. You have to be the person who is, fighting the battles for them if they have medical issues, etc. Because doctors who are incredible have got so much going on. They can't be the main advocate for your kid. You kind of have to be, and same with our own bodies. I think that it's a shock to realize that there isn't more information out there. It's getting out there. We're doing our best to get it out there. People like you are amazing, but it's kind of like women have to be able to take the information to their doctors and say, I've done the research. This is what I found out. What do you think? How can you help me? And definitely not take no for an answer. It is what I have now learned. Is that your experience?
Well, yeah, it is. It'll be interesting to see when I go to the new GPs that I've registered with about the HRT thing, when I want a continuation of what I've done privately. It'll be interesting to see what that experience is going to be like. So what's the space? But I've been very, very underwhelmed with the support so far. It's really sad because, I've got women coming in here falling apart for no good reason at all. And coming, so that's menopausal, but then postnatally, I've had 4 inquiries just this week of women who've had their babies in lockdown who've gone, I've had my 6 or 8 week check, and they didn't look at me and they didn't touch me, and I think maybe it's just lockdown, but I feel like I sort of need somebody to have a good look at me, and I'm like, it's not just lockdown, love, that's it, look at baby, and there's no, very, very rarely will somebody even look if you have a tummy gap, or look at what kind of trauma you've had, of your patient 3B tear, like right through the muscle, and the care has been abysmal. Which I probably shouldn't be talking about it too publicly, but it's not okay. I'm sorry, it's not okay. We need better women postnatally. We need better.
And it's like everything.
Stop. Actually, better medical care. Last year I was on a conference with the Lifestyle Medicine Association, and we were talking about loads and loads of studies of women in sport. It was all about, not women in sport, but athletes, well-being, activity, all of that, and how that helped with mental health. And every single study quoted was done on men. Every single one. By the third speaker, and you must know, these are loads of GPs that have trained in lifestyle medicine, and myself, and some nurses that have trained in lifestyle medicine. And loads of them are women. In fact, the majority of people there were women. And, the third guy got up and he said, I have to apologize, but my studies, because people were asking, are any of these studies done on women? What is the results of women? Because of course it's going to be different. We're not just small men, we're very, very different creatures. And the third speaker got up and he was like, I have to apologize on these studies, but again, they're done on men. And then he went on to explain that, studies are done on men for whatever reason, easier, they're not as complex because they don't consider what's happening, what time of the month, if they put them on a certain drug. But we have loads more interactions with drugs than men do because we're not the same. You can't just put us on a smaller dose of whatever. But that is what's been happening in medicine so far. So I know on one of many groups that we've had that conversation about care for women and well-being for women, which, it's just not good enough. But I think as more women are coming into positions of power and educated positions, this is changing. When we have to fight. It's like fighting for the vote, isn't it? But fighting for research to be done on women. If a woman has high blood pressure, why do women die more of heart attacks than men do of their first heart attack? It's important for us to know, and it's important for us to fight for those rights as well. So from the pelvic floor up.
Absolutely, and hallelujah to the sort of work that you're doing, and I'm trying to support as well in yoga teaching, just getting information out there that even trainers just don't know how to look after women differently from men, because, you know, Joseph Pilates was a man. Most of the yoga traditions came from men, and they were developed around young men to help them meditate, etc. And once a woman has had a baby, their pelvis is changed forever, basically. And it's so my take is that the Me Too movement a couple of years ago has kind of kick-started this eruption of women just going, it's not okay for us to not be seen and for our individual needs to not be recognized. And suddenly we've got lots of people who kind of have just muddled through before, or not really known who to speak to about their concerns. It's been there in the background, but it hasn't been in the media. And now suddenly there is more of a platform, and hopefully we'll see in the next 5 years or so that just accelerating.
Well, I certainly know with the Mummy MOT and on Instagram, where they're very active, you know, there's lots of celeb moms coming out and talking about incontinence and talking about, you know, post-birth injuries and mental health and all those things that's so important for us to be talking about, because once we talk about it, we can get the help we need. But if if nobody's talking about it, then, you know, it's a shameful little secret. You know, it really needs to change. Yeah.
Well, hopefully also we'll get more GPs working with referring to people like yourself, you know, or to people like myself, so that there's not just this kind of, oh, we'll go off and do your squeezes and you'll be right, love, see you later. But there is a lot more respect given to the fact that, you know, we're living, 30, 40, 50 years beyond menopause now, and we can't be thinking, right, life is all over. It's crazy.
I feel I'm fitter and stronger and healthier now than I was in my 30s.
So you're so gorgeous in every way.
Absolutely not planning on, you know, hanging up my boots just yet. You know, you've got to adjust and change the way you train, certainly. But I can do other things that I love, if perhaps for whatever, and I'll talk about my pelvic floor here, it could be my shoulder or my knee or whatever, because, you know, life happens. But I wanted to come back to something you mentioned about trainers, and this is something that I've made my own personal little bugbear. Every time I go to a CrossFit box, which is the training I've been doing over the last 3 or 4 years, and a lot of women in CrossFit league. I mean, there are courses for physios that work with women who do CrossFit, because, you know, pelvic floor courses, because so many of them, because they're jumping, skipping, you know, hopping, all sorts of stuff. And it's great fun. It's wonderful lifting heavy weights and squatting. And in fact, there's some research, I don't know if I've sent that to you, I'll send it to you, about women who lift weights actually less likely to leak than women who do light training. So interesting analysis of studies. So I'll send that to you. But you go into a CrossFit box, and if it's the box you know, and it's a trainer you know, then you could go and have a word, couldn't you? But more often than not with CrossFit, you don't want to take 2 weeks off because you die when you come back. So when you go on holiday, you find a CrossFit box so you can continue training, so you don't have to come back and rebuild your fitness. And you go to the box, and I can't run, not because of my pelvic floor, you know, various other issues with my body, but I can't run. And they'll go, oh, okay, then you can just do some jumping jacks. And then I'm saying to them, no, I can't run because of my pelvic floor, so I'm certainly not going to be doing jumping jacks. Just to educate them, you know, just to say, if the woman who's really leaking hasn't got the confidence or the voice to say that, I'm going to say, because you should be aware, if a woman's telling you I can't run, it may well be because she's leaking. Telling her to do jumping jacks as a warm-up instead, not okay, you know, star jumps, no, put her on a bike, you know, let her warm up there. So every single box I've been to in Portugal, in Israel, in
should we sit down and have a coffee? Because I have a few things to say to you.
Have a word, just have a word, mate. You know, I ain't going to cope with that. So, you know, find an alternative.
I've just lost you there, your voice.
So just tell them to find an alternative and give them ideas of what it is that they can do, you know?
Yeah, yep. And I think you're right. All of us as women, and whoever watches this, it's important that all of us start demanding a lot more of the people who are working for us. You know, if you're, whether it's a yoga teacher or a Pilates teacher or a cross trainer or a doctor, essentially you're paying them, whether it's through your taxes or through your money, to serve you. And so if somebody doesn't know their stuff, then you have every right to be able to say, okay, this is not okay, and please go and learn how you can look after me better. I had a one-to-one with a woman recently who's had 4 children, and and she's in her mid-40s, and she had started leaking. She had never ever, so she works with a personal trainer all the time. She had worked with this guy for many, many years, and not once had he ever mentioned pelvic floor work. He never checked her breathing. So when I did, I could see that she didn't use her diaphragm at all. She was just, when she breathed, her tummy was ballooning out. We checked her coughing and stuff, and so much pressure downwards. She had unbelievable rigidity around her jaw. So there was so much down training, and her posture. Oh my gosh, you know what I'm like with posture. So I was, and so she was doing, lots of planking, lots of all the bits and pieces, and thought she was having a good workout every week, but it wasn't good for her body. And she just didn't know to question and say to him. So luckily we had this one-to-one, and then she was able to go to him and say, listen, now I want to start working with my pelvic floor, and I need to work on diaphragm. So give him his due, he went off and learned what he needed to learn to actually help this particular client. So I think that the more women who start saying, whatever class I'm going to, we need to recognize that, especially, but it's not even if you've just had children, any woman, you're going to be a nun, and you
always postnatal. That's something to recognize. Pelvic floor is the postnatal pelvic floor from there onwards. And that's really important to recognize. And if you've not had children, you are still having hormonal changes and tightness and shortness because of stuff that you've done, and maybe a fall you've had.
Posture.
Posture, absolutely huge. And as you say about the jaw, that rigidity of the jaw that just holds everything. If I hear a woman with a really high-pitched voice and that's sort of tight, and I can just see the diaphragm pulled all the way up, and I can almost see the pelvic floor, shoved all the way up there. And I'm just like, can we just breathe and get the pelvic floor down? And it's about learning that it all literally is connected fascially, as you were saying. And, the jaw's connected to the psoas, and that sort of carrying that tension through there, causing the tightness through the hips. It is very, very important. But I think the thing with personal trainers as well is understanding, if you've got a client for a long time, that their body is changing. And for us to understand this, because if you love your personal trainer and you have them for 5-6 years, and you may be from the age of, say, 37 to 42, you're very different, in that time, especially if you've gone ahead and had a child in that time. So it's about understanding that where, maybe a plank was your ideal exercise before, maybe it isn't anymore. And I've certainly that's been my journey this year with various injuries and menopause. And I've had to recognize that actually, CrossFit right now is not the thing for me to do. And I love weight training. I really do. There's nothing that makes me happier than picking up a barbell. It just isn't for me right now. And I don't know if it will be again, maybe not. But understanding that at this point, my body wants Pilates, and it wants yoga, and it wants some HIIT sessions, and it wants a few sort of rehab bits, and it loves going on the mountain bike. And I feel good when I do those things, and understanding that what I could do last year and what made me feel good last year is not the same. What's that term in yoga you talk about, knowing thyself?
Yeah, well, there's two. Santosha, which is the acceptance, what you're talking about right now, acceptance of where we are at this point in time. And through that acceptance, that's when we actually start to see change. So that is contentment with what is presenting at this moment. And then the other self-study, the Swadhyaya, is when we are able to, almost like we're standing outside of ourselves, or looking like a best friend would look at, their best girlfriend, would just look with compassion and love and a little bit of humor, and see what is happening mentally and physically, and not attaching all the stories, to what is happening. If I didn't this, which we are so good as women at beating ourselves up and talking so negatively. And I think that these concepts in yoga are so lovely at just helping us to separate from the egos, and actually going, you know what, this body has done some pretty cool stuff, and let's have a little bit of reverence and a little bit of self-respect for what it has done, and not so much identifying that the body is who we are, but simply that this is the cloak that we're wearing through this lifetime. This is this instrument of life. And if it needs help from another person, get that help. It's not serving us. I always talk about the bird eye view, and when you want to be 80 or 90, you don't look back and go, damn it, why was I so ashamed of my body when actually it was amazing.
Yeah. But Linda,
Like, why can I do these
even
things?
looking at myself as a 20-something, 30-something year old, and the amount of self-loathing and the lack of self-compassion and the lack of kindness, and I look back now and I think, gosh, she was hot as anything, what were you on about? So now I try to bring that hotness forward and be with the hotness, and just it's taken me a long time. I think for many, many women that's an issue, that kindness, having a kind voice. I remember last year driving someone feeling a really positive regard. My sister's a psychologist, unconditional positive regard for myself, and just feeling real love and compassion and kindness for myself, and having a kind voice in my head. And I was so moved by it because I've been working on that for a long time. And certainly one of many has helped me with that tremendously, about, and Brené Brown's work, not working for your worthiness all the time, and acceptance and compassion for yourself. So it's a journey for most of us, if you've come from a very self-critical, perfectionist kind of background, and certainly this planet is going to push you to that sort of, yes, that's the way to go. You want to be superwoman, you want to be doing everything, you want to be doing everything perfectly while looking smoking hot. It's just not, it's just not possible. And we shouldn't be hard on ourselves because we're failing, because you're not failing, you're just being, and that's what you're here to do. And one of my patients gave me such a wonderful tool. She came in and she said, she's a yogi actually, and she came in and she said she'd started working at a nursery, and where you pot plants and stuff. She was taking time away from yoga, and she walked in the morning, and it was a cool morning, so she was wearing her welly boots and her shorts and a tank top and a hoodie. And one of the guys looked her up and down and said, "Oh, nice outfit." And she looked at him and she said, "I didn't get dressed for your gaze."
I like that.
Isn't that powerful? It gives me goosebumps even now, because I think, sometimes we do something for somebody else's gaze. You put your makeup on because you're doing a presentation, you wear a bra because you're going off to some whatever, and And I think I'm more and more thinking, for whose gaze am I doing this? And if I'm not interested in the person's gaze, then I don't do it. And that's been really, really powerful for me. If I don't care about that gaze, for my partner, maybe I want to put my mascara on because he likes my eyes or whatever, and I'm happy to do it for his gaze. And I make sure that he knows I'm doing it for his gaze. But I'm just not prepared to, and I hope more and more women get more powerful in that way, where you're not doing something that it's not just for the gaze, but for that person's approval, or for, do you know what I mean?
Yeah.
Really for us to learn that lesson.
And, swing this back to the whole pelvic floor stuff. It really is having that ability to have enough reverence for yourself that you don't put up with things not working. You don't put up with pain. You don't put up with leaking or heaviness. And you certainly don't put it into a box of shame and just cut it all off and say, I can't look at that myself, therefore I can't also look at it with my partner, and I'm just going to shove it away and pretend it doesn't happen. And if you're starting to feel terrible because hormones are completely unbalanced and pelvic floor issues are getting worse, rather than going, that's it then, I'm obviously just going to, end up with my cats and depressed and know that. And the trouble is, when you're in that state, it's very, very hard to know how to get help. But I guess both of our messages is there are enough women out there now who have climbed themselves out of the hole, who know that hole. I know that hole, and I know you know that hole, and are feeling stronger and are wanting and willing to help get this message out there and help other women to also, get back onto their feet and start to feel better, and just having that hope that you can feel better. You really can feel better. It's not just a bumper sticker. You really, truly can.
Absolutely. And it's about holding that space for women to do that growth, because sometimes somebody's not quite ready to do some of that growth, and you've just got to hold the space for them while they're there. Whether it's with their pelvic floor or because very often the pelvic floor is the issue that brings them into me, but there's so many other life issues going on as well that need dealing with, and holding the space for them so they can stand up for themselves. And I think something you mentioned about not even talking to your partner, I find this and I used to find it surprising, and now I find it quite obvious actually, is that the very strong, independent, women that were earning loads of money, whatever, would come in here with a pelvic floor issue, but they wouldn't discuss it with their partner, because for them it was a flaw. They were broken. I've had women crying on my couch going, I'm broken because I have a prolapse. I don't want my partner anywhere near me because it feels different. And of course, partner can care less, really. They just love you, and if there's an issue, they want to support you through it. But they also need to understand, and if you don't understand, you can't help them understand. So it's about that education, isn't it? And that self-love and compassion, and demanding, that hurts, I don't want you to do that. I'm going to have to go off and do this before we can do that again, because that hurts me. Does that make sense? And just understanding that you do have to come first in this. You have to look after you first. You really do. Whether you're a new mom or whether you're a menopausal woman, you've got to put yourself first.
Filling up the cup so you can spill over for other people. Yeah. If you're at your wit's end and you're exhausted and things are falling apart, it can feel very bleak, can't it? And I always say it's up to us women really to in these next years ahead, these next decades, to be the ones who are spreading our loving arms around the world and hopefully taking us into a better place. And we need to feel good in order to do that. We need to feel good ourselves. So actually it's the most selfless thing in the world.
Absolutely. You don't get women in a state going out there and changing the world. You just don't. You need to be okay to go out. And as you said, you have to spill over. It's not about just having a cup and pouring out of it. No, that cup is all for you. It has to pour over. There has to be so much in there that it spills over, as you say. And that's an important distinction, I think, as well to make, isn't it?
Well, on that note, I think that's just been wonderful. Thank you so much. Is there anything that you didn't touch on that you think, oh, I just would love to say this?
I think the Pelviva, which I've mentioned to you, which I really love as a product, partially because...
Can you just show us the box?
I'll show you. The box looks like so.
Yep.
And then they come in like a little pouch, and I'll show you what they actually look like. And it's like a rather large tampon, but it's still smaller than most.
Rather large tampon.
Yeah.
Yeah, okay.
You can get it in, can't get it out.
Oh, yes. Yeah.
And what it does is it gives a signal through to the pelvic floor muscles and gives that contraction. But the great thing about it is that because you're conscious of it, it gives you that connection between the brain and the pelvic floor, which is what we spoke of earlier on, it's like connecting.
And I remember,
getting those neural pathways, the neuromuscular pathways to work. And it might just need 3, or you might need, 3 months worth to get that pelvic floor really bulletproof if you want to be doing whatever sport you want to be doing. But I found them really effective for lots of things. And even though I don't leak, the one place that I feel really vulnerable on is on my bike going up a hill, that kind of sensation of like, could I be leaking? Because, you're sweating anyway, so you don't always know. And certainly that seems to be gone, getting through the night, without having to get up and go through the loo and disturb your sleep, which is so important. And certainly makes a difference to orgasms as well, which is also important for quality of life. Yeah. So I highly recommend that as a product. And you do get ones that are not disposable, that are, one you use over and over. But the reason I like this one more is because you can stand with it in and you can walk around with it. Your pelvic floor is working as you doing your stuff, So yeah. I recommend you start off with it lying down just to get used to how it feels. Once you get that feel for it, standing, walking, getting on with your life, and getting the pelvic floor to work while you work, do your stuff. And it takes half an hour, 3 times a week, is a sort of recommendation for up to 3 months, and then you can go into maintenance if you need it, or you may not, you just do your sort of squeeze stuff. And I really love that.
You were saying to me before that it can be very helpful especially if you're relatively recently postpartum, you haven't done pelvic floor work and you just can't feel anything much. So if somebody says to you, okay, we want to draw the pelvic floor muscles in and lift them up, and you're like,
I know what you're talking about.
So this can just do an electrical pulse stimulation to actually make those muscles start to be able to contract again. So that could be incredibly helpful.
Feel the contraction, you start working with it, and then once you start working with it, you get that connection with the brain. And then the last thing I'd like to say, I think, is when I started doing pelvic health physio, it was really interesting to me because, musculoskeletal physio, you're working quite reductionist, your hip, on the knee, on the shoulder, on the hip, on the back, And even though things were connected, when I started doing pelvic floor physio, it was like somebody had taken away a big red no-go zone in the pelvis, and I could start seeing the connection between that tight adductor on the left-hand side and the buttock pain on the right-hand side, and oftentimes traveling through the pelvic floor. So if you're a woman who has that no-go sign from the belly button down to the middle of your thigh, you know, do some exploration. The book I'd highly recommend is Wild Feminine by Tami, something or another. Absolutely brilliant book for you to reconnect with your pelvic floor and see what you've stored down there in that pelvic bowl, the emotional stuff, the physical stuff that we often, one of my clients say, we suppress and rise above. We suppress and rise above as women, and where we're suppressing to is in the pelvic girdle, in the pelvic bowl. And it's no wonder that it gives away eventually, because how much is it supposed to carry, you know? So Wild Feminine is a great book. And then from a more sort of sexual point of view, if you want to understand, you know, libido and pain and all those sort of things, there's a great book by Emily Nagoski called Come As You Are, which is one of my book recommendations that I give patients quite a lot, just to understand your own sexuality, really.
So could you send me those titles and the authors, and we'll put that in the comments, and so people, if they want to look up those, they've got that information. So we'll put them, not that I really know what show notes are, but we'll put them in the show notes.
Oh, you know more than you do. I'm just happy I could open Zoom tonight.
Yeah, well, at least we got on Zoom. So we didn't do so well on Facebook Live, but we got Zoom going, so that's good. Hey, listen, thank you so much. It's been such a pleasure to talk to you, and you are a wonder, and I just hope that more women get to come and see you and then tell their friends and their mums and aunties and everybody else that, yeah, it's not okay to put up with pain and leaking and other issues, that we can do something about it.
And I think the beauty of lockdown, having done so many virtual appointments, is understanding that I can help women even when they aren't close by. And if I do feel they need to go in for an internal, then sending them to somebody locally. But being able to educate and support and help them anyway, you know, even if we can't see them face to face. Yeah.
Oh, well, honestly, it's been such a pleasure to talk to you. Thank you very, very much. And we'll see you soon.
Thank you, Linda. Have a lovely evening.